The views and opinions expressed by our guests are their own and do not necessarily reflect the views of the California Secretary of State's office.
Hello, my name is Julian Castillo, and I'm an elections analyst and outreach coordinator with the Secretary of State's office in the Elections Division. I am joined today by the wonderful Kalika Edwards, so I'll pass it on over and let her introduce herself.
Hey. I am Kalika Edwards, and I am also an elections analyst and outreach coordinator with the Secretary of State's office in the Elections Division. Thank you so much for tuning into the second episode of This is Promote the Vote California, the podcast. Promote the Vote California is the newest initiative to come out of the Secretary of State's office and is focused on California communities and advocating for a strong civic culture. Our combined mission is to leverage the power of partnerships by building relationships with businesses and organizations to support California communities and improve civic culture. What we really want is to foster a meaningful dialogue among individuals and groups, providing reliable, accessible information on voting and how to be civically active.
The California Secretary of State's office is celebrating the 60th anniversary of Freedom Summer, and this podcast will be focused on furthering the conversation around service, civic education, voting engagement, and equity in California communities, all while drawing lessons from Freedom Summer's collective action. Today, Freedom Summer still stands as a testament to the power of unity. It brought together leaders and everyday citizens from all across the nation and beyond to combat disenfranchisement. This unforgettable and historic movement served as the catalyst behind the enactment of the 1965 Voting Rights Act.
To continue the conversation that was started with Freedom Summer, we are so honored to be joined today by Dr. Ilan Shapiro from AltaMed Health Services to discuss health equity and civic engagement in underserved communities. Dr. Shapiro is the Senior Vice President and Chief Health Correspondent and Medical Affairs Officer for AltaMed Health Services. He supports strategies for external health communications, advocacy, and community relations. As the Chief Health Correspondent for AltaMed, Dr. Shapiro works closely with public affairs, community affairs, governmental relations, and civic engagement departments to help expand community health and wellness initiatives.
To sum all of that up, he is beyond qualified to speak on health equity today. Dr. Shapiro is a tireless advocate for healthcare equity with a deep affinity for innovation and public health policy, especially relating to the Latino population. Dr. Shapiro's background includes award-winning public health work, often on the international stage. After graduating as honorary valedictorian with his medical degree, he worked for the Mexican Secretary of Health as a liaison between Mexico and the World Health Organization.
In 2011, he was invited to join the White House Hispanic Policy Group and help educate and raise awareness for the Affordable Care Act. Dr. Shapiro is also a recent recipient of the Otley Award, an honor presented by the Consul of Mexico to recognize individuals working to improve the lives of Mexican nationals living in the United States and abroad. Prior to joining AltaMed, Dr. Shapiro helped numerous health and leadership roles that focused on traditionally underserved communities.
He also spent 5 years working with migratory agriculture worker families and the unhoused in Southwest Florida as a pediatric resident at Mount Sinai Children's Hospital in Chicago. He believes that these roles sparked his passion for meaningful community-focused work. In addition to his work at AltaMed, Dr. Shapiro serves on the Board of Governors at LA Care Health Plan and the Gasol Foundation.
We are so thankful to Dr. Shapiro and our friends at AltaMed for taking the time to make this conversation happen. We hope everyone listening will take a moment to reflect on their own experiences with health equity and civic engagement in healthcare, and open your minds to learning a different perspective today. We are so excited for this opportunity to speak with Dr. Shapiro, and we hope y'all get to learn something new as well. Be sure to stick around after our conversation with Dr. Shapiro when Julian and I break down the episode for further reflection.
All right, well, Dr. Shapiro, thank you so much for joining us today. And thank you especially for sharing your voting story with us a few months ago. That video is now live on the Secretary of State's social media platforms and our Promote the Vote website. So if our listeners want to go check that out after this episode, we would really encourage that. We shared it with everyone in our office and they really loved it. So we want all the eyes on it. It was so beautiful. So after watching your voting story, we could see that your passion for serving your communities and your dedication to being an advocate in the healthcare space was really apparent. It's obvious. It's very, very clear. So can you tell us a little bit about AltaMed's work and its involvement with its communities in the exam rooms and beyond? And then how does that work also help fuel your own passions?
At the moment that I chose to be a doctor, there were many choices. And one of the choices that I actually encountered was to connect with my community, because we're all humans. We want to make sure that we're connecting to each other. And sometimes when we go to the doctor, we see our nurses, our mental health specialists, they can do so much. And sadly, when you see the amount of people that are suffering in our communities and you compare them to the amount of people that are voting, they are correlated. And what do I mean with this? That areas that we have more diabetes, more pollution, less access to green spaces are the communities that actually have less, action with voting. Then AltaMed recognized that with My Vote, My Health. At the moment that we saw that opportunity where, and I can tell you for sure, and you have heard it before, that me as a physician and all the amazing physician, nurses, and providers that we have, at the moment that we see a patient, we can only move 20% of their health. Even if you give me all the millions of trillions of any currency on the world and all the specialists, I can only move 20%. That other 80% is actually on the communities. That's why it's so important to talk about civic health. And that's what we're doing in AltaMed. We're connecting the dots where, in a safe space, in a way that we can actually connect the same way that we have very, very hard conversations with our patients, or very happy conversations from, like, you're free from cancer, or the other way around, like your heart is not working the way it's supposed to. And sometimes we are afraid of talking about voting, about being represented. And that's what we want to come with that message, to make sure that we're talking about civic health. Us as healthcare providers, no matter in which part you are, at the moment that we talk about, food insecurity, we talk about making sure that you move and you eat healthy. Also, a big important thing, if we want to move forward the conversation in our communities, in making sure that we are all represented. And the best way to do that is voting.
I could not agree with you more, Dr. Shapiro. So, Promote the Vote's main focus is to encourage civic engagement, and we strive to provide voter education and access to resources that will in turn translate into civic action and get folks to show up at the polls. So, how does the work of AltaMed translate into civic action?
The beautiful part is that instead of making it something that it's difficult, far away from everybody else, because we all have a lot of things in our lives, right? Like a lot of the patients that we serve, they have 2 or 3 jobs, they have a family, they need to have transportation, they need to actually do a lot of things. And when we actually have the privilege to serve them in our clinics, we have the opportunity to move along that 20%, and also sparkle a little bit of the joy on that 80% that it's all the social determinants of health that we have around our communities. Then the way that we're connecting the dots is not separating that 80%. And a big chunk, as you mentioned, is actually being represented by voting. Then at the moment that we go to a place, and let's talk about the supermarket. If it's easy, fast, and reliable, you want to come back. And if you have, like absolutely everything there, you have someone that will cut your hair, someone that will take care of your kid, someone that will take care of you, and we package it and make it easy. That's what we're doing. We're making sure that civic health is part of every activity that we do when we touch a patient. And it looks in many different ways. When you go to the clinics, we do have a lot of, voter registration forms inside of our waiting rooms. And, like I love every doctor office in the world, but there's some waiting time. It could be very fast or a little bit, sometimes a little bit longer. But having those forms there can make a huge difference because you're waiting and you go, oh, what's that? We have QR codes with videos and information. And in each step where a patient comes into the clinics, there's my Vote My Health information booth. There's pamphlets. There's a lot of things. And also as providers, we carry a QR code that also mentions, like if you need more information on your zip code, get the QR code, and actually it will take you specifically to the place that you need the information for. That means that if you're in East LA, that's a different zip code, it will actually tell you how to register in your area and give you a little bit more information of what's happening around your area. And all of these things actually start piling up to the point that at the end of the day, you see your physician, they tell you, yeah, you're good, you get your vaccines, your vitamins, whatever. But at the end, we have that 1 to 2 minute conversation on do you know what's happening in November? Do you know, are you registered to vote? And carry that conversation. And it's 1 or 2 minutes where we, as healthcare providers, are opening the door to that part, connecting our physical health, our mental health, and also, very importantly, our civic health. And that's just what happens in the clinics. But let me tell you one more thing. The clinics are magical. They are amazing, but the real magic happens when they walk out of the door, when they actually go back to reality, to their communities, to the zip code. And at that moment, we also have a lot of engagement. We go out there in community events. We make sure that something that we started actually doing that is called White Coats for Change, meaning that doctors, nurses, healthcare providers, dentists, we all go together to knock on the doors. Imagine that you're on a Saturday and suddenly your doctor of your clinic on the corner is knocking on your door with a white coat, and he's asking you, and you're like, okay, what's happening here? This is weird. And I have had a couple of patients that go, is everything right, doctor? Did I miss a day for something? And on reality, it actually, no, nothing is wrong. And we start a conversation about civic health and civic engagement. And, we're here because you're important to us, you're important to the community. And we start the conversation of connecting the dots on being represented, green spaces, better schools, decreasing pollution. And most of absolutely all my patients, and we have done this for almost 6 years, most of my patients go like, thank you, doctor. I'm getting it. I'm starting this conversation. I thought that my vote didn't count. It's only one. But when you start connecting the dots and actually informing, because my objective is, and our objective is to make sure that they have the information. And after that, everybody can choose whatever they need to choose. But the most important part is actually being part of the conversation.
Wow. Yeah, I love the thought of you guys leaving the clinic and going to where your patients are. I think a big barrier to civic engagement is the accessibility, and then also just not knowing where to start. There's so much information out there. And, to folks who are not as involved as, say, we are, it could be really intimidating and really scary to take that first step. But I think what is so beautiful about what AltaMed does, especially, is that you are providing this information in a safe space. Physicians, doctors, nurses, those are all trusted sources for your communities. They come to you like when they're the most vulnerable, and they believe you, and they look to you guys for answers and for guidance. And so the fact that you guys have a program to provide that information, like I said, in that safe space is, I mean, is life-changing. I think there are so many folks who don't know where to start, but it starts with a doctor visit, which maybe they weren't expecting. And I really like that. That's incredible.
And Julian, let me tell you
Yes.
something that I was forgetting completely. We're talking about connecting the dots and making it easy for everybody, knowing
Hmm.
that we all have different things happening. We also in LA County, and we're trying to do it also in Orange County, to have ballot, the mobile ballot opportunities. That way, when they come to the clinic, they have the opportunity at the place to actually
Hmm.
vote. And it takes like 10 minutes. It's not a long
Wow.
process at all. Then you're going there, you didn't know that you needed to vote, and actually you end up voting. Then
Yeah.
we're trying to capture those spaces and also the opportunity to have that conversation with our elderly patients and with absolutely everybody else. Then that's kind of the important things that we're having. And it's a huge opportunity to have that. We have the mobile ballot things also, and that's one of the most important things, making it easy, reliable, in the places that because that actually feels homey, that actually feels
Yes.
better, that actually feels the way that we supposed to be doing things.
Absolutely. Yeah, when you're comfortable and you feel like you belong in those spaces, sometimes polling places can feel a little intimidating to folks who maybe have never been to one before, or maybe who don't get out of their house much. But having these spaces where people feel comfortable, and they feel welcomed, I think that that's like a huge key to getting people to actually vote, which is it's so amazing. So one thing that I do love about AltaMed especially is that they are very vocal about identifying the communities that you guys serve as being largely Latino, multi-ethnic, and underserved communities in Southern California. So why do you believe that it's so important to highlight these aspects of their identities? Like why go the extra mile to identify that, they're multi-ethnic and Latino and underserved? Like why is that an important part of their identity and what you guys do?
We have all gone to a restaurant, right? And when you go to a restaurant, you have a menu. And there are restaurants that we like more. There are restaurants that actually we prefer more. That's actually kind of the one that we love going for celebrations,
Hmm.
birthdays, any type of good moment, we go there. And we already know what dishes we like. We
Hmm.
already know how, like we maybe if it's on the corner, we know the waiter, we know the owner, we know a lot of the people that are around us, and we feel at home. We feel that we're going to get a rhythm. But if you go to a new restaurant that it has weird letters, the menu is written in Jupiterian.
Hmm.
We have all these things around us. Then it's different. Maybe the food is the same, but make having at the end of the day choosing the correct dish, feeling full. Making sure that we are not having all the problems with any type of allergies. All of these things are part of the process that we have. Then that's why it's so important to have language and also
Hmm.
culture as part of the things that we serve. Why? Because at the moment that you have the same language and also it's culturally concordant, it helps.
Hmm.
Then at the moment that you see your doctor talking the language that you speak, understanding, maybe he or she doesn't understand your language, but understands that your language, your culture. The tecitos that are very famous in Hispanic communities, or certain alternative medicine things. Then you start understanding more. Then that's why it's so important of the things that we do in AltaMed, because we cater specifically, linguistically, and culturally concordant way in order to have a better impact.
The relationship between the doctor and the patient is so important. And I know for myself, when I've gone to see a doctor, to have that cultural connection um, makes you feel more safe in that space.
Absolutely. I definitely agree that there is like a comfortability that patients and doctors should be having. A lot of times people are scared, to visit the doctor's office, but when you have someone who speaks your language, who's in on the cultural jokes with you, that adds a whole new level of comfortability.
And also
Cool.
understands your because culturally we all have certain things that impact our health that we need to keep an eye out on. And so to have that connection where someone is understanding you and your community is worth its weight in gold.
And I agree with both of you. And we actually have seen something very interesting. It was an article published last year. One of, and it's quite powerful and speaks to the conversation that we're having right now. One of the most important things for African American kid that actually is in neonatal intensive care unit, we call it the NICU, is actually having an African American doctor. That's more, if you put absolutely everything side by side, the survival rates, and actually then it speaks a lot about the culture, the language, and actually the connection. And that doesn't mean that we don't have doctors that come from Mars or Jupiter that are better or worse. No, but it actually highlights that there's a magic that we're starting to understand when you actually see someone and they see you as you are, with the language, the culture, the way that you're coming from a community. Then, and that's the power of civic health, because it doesn't matter if you vote for the green party or the blue party or the purple party or the red party. It doesn't matter. It's actually being there historically. And the thing that it's a lot of people ask, why have our communities been not engaged? Well, there's a lot of reasons, but I'm just going to give you the point of access. One of the things that we have seen is that if you go to certain communities in California where the economical status is higher, they have multiple more voting areas when we have elections. And imagine that they have 10 people living in that city. And if you go to another one that, like the communities that I'm serving, it's only 2 instead of 10.
Yeah.
Then you see the disparities here, and we're moving forward. Before it was not recognized, now we recognize it. We're having that conversation. That's the powerful part of it, because if and it happened to me, and that's why it's so important for me to have these conversations, and actually for AltaMed, that before I used to scream a lot. I used to like, oh my God, this is horrible. This is horrible. But the way that I can actually convey my message, apart from saying that it's horrible and recognizing that we can actually improve it, is giving ideas and also being civically engaged, making sure that my civic health is actually improving. And the way that we connect my vote and my health are crucial.
I love that AltaMed's mission is to focus on eliminating those disparities in healthcare access and outcomes, and connecting that to civic health. With these goals in mind, how do you answer the question from your patients and community members when they ask, why should I vote? Especially in this year in the election cycle, a lot of people are contemplating that question. And if you would like, please also answer it in Spanish.
Con muchísimo gusto. I will start in English, and after that, I will add the part in Spanish. What are the most common things that our doctor tells us when we see them in our clinic at the end? Is making sure that we're eating well, that we're doing our exercise, and actually taking care of our mental health, and of course, the community part of it. Then I walk as a patient out. I open the door of my clinic and I go to my community, to the reality, not to that bubble, to the reality. Then I recognize that green stuff is better, salads are better. And I go to the supermarket and I do see that salad, but I see also in the back part of my mind, my family. Then I need to choose from the salad, the green stuff, the healthy stuff, or what's actually happening and fight hunger for my family. It's an easy choice. I'm going to for sure fight hunger in my family. And some of the times that choice is not the healthiest one, but it's the one that I can actually give and have for my family. The other thing I told you about exercise, that I go out, I'm ready. Dr. Shapiro told me to actually do exercise, and what happens? One is maybe I don't have green spaces around me. And no, wait. I'm very lucky. I do have a green space. Is it safe? Then we have a lot of barriers there to actually start changing our way of our community. Those determinants, that environment, that the air that we breathe. And when I connect that to my patients, to the health part, and I tell them, like, if we're voting, more resources can actually come here. We can actually uh, help craft that environment around us, not only for us, but for our children, for the future generations, for our elderly, for people that cannot have that voice. Then that's why it's so important to continue this conversation, continue actually making sure that we're represented, and we all have different opinions, and that's perfectly fine. And that's the fun part of this. It's not a problem. But if you sit down on a corner and you're quiet, you're not going to be seen, you're not going to be participating, and the only thing that you're going to end up doing is actually complaining that things are not moving forward. Then, I prefer to actually start moving, doing things, and making sure that we have that opportunity to bring our feelings, our life, our things that we see every day, and make a huge difference. Now, switching to Spanish. Parte de las cosas importantes y lo que nos dicen siempre los doctores es que nos tenemos que asegurar, y hay tres cosas, asegurar de hacer tres cosas al momento de salir a la clínica, y todos lo sabemos: comer bien, hacer ejercicio, cuidar nuestra salud mental y otras cosas más comunitarias. ¿Y qué es lo que pasa cuando veo al doctor Shapiro y salgo de la clínica? Al momento de salir, pues digo, bueno, ya tengo que comer bien, ya lo sé, ya sé que son las cosas, las verduras, las cosas verdes. Llego al supermercado y lo veo, pero también atrás de mí, en mi mente, está mi familia, toda la gente que le tengo que servir. Y por otro lado, está la parte y la opción de luchar contra el hambre. Y desgraciadamente, muchas veces escogemos la parte de luchar el hambre porque es lo que hay, es lo que tenemos. Entonces, al momento de luchar contra eso, muchas veces esa comida no es la mejor para nuestra familia, no son esas cosas verdes que nos van a volver saludables. Y no es una opción que nosotros queremos, pero es la opción que tenemos. La otra parte que pasa, la parte del ejercicio, al momento de salir, bueno, digo, ya, el doctor Shapiro me dijo que tengo que hacer ejercicio, voy a buscar un parque para hacer esto. Busco un parque y tal vez no hay en mi comunidad. O los que hay simplemente son no seguros y no agradables para mí o para mi familia. Entonces, al momento que nosotros vemos esas conexiones de cosas que son muy importantes, que son determinantes sociales de la salud alrededor de donde nosotros vivimos, la única manera de poder empezar a cambiar esto es asegurarnos que estamos participando cívicamente, que nuestra salud cívica sea parte de esto, y sobre todo que no importa hacia dónde vayamos, si nos gusta el color, el partido del color morado o azul violeta, da igual. El chiste es dar nuestra opinión y ser partícipes de eso, porque de esa manera nosotros podemos agarrar y tener una mejoría, no nada más para nosotros, pero para nuestros hijos, para nuestras familiares de la tercera edad y aquellas personas que no pueden participar en este proceso, y de esta manera poder empezar a poner estos granitos de arena para hacer una diferencia.
As soon as you started giving your message in Spanish, the first thing I thought of was I get to now share this episode with my grandmother. And that kind of made me a little teary-eyed. I don't often get to share aspects of my work with her because of obviously the language barrier. So getting to share this with her is going to be very exciting. So thank you very much for giving that in Spanish. That was very beautiful. I just want to say thank you for taking the time to speak with us today. Obviously, the work that you do is so important. And I'm so happy that we have found this kind of partnership between the Secretary of State's office and AltaMed and the work that you guys do. Being able to support you in that has been so wonderful to witness. So I really hope that this conversation can kind of move beyond this platform that we have here and can inspire folks to not only register to vote, but also to advocate for their communities and to help each other find their voices. So thank you so much for being here with us today. We appreciate
Yes.
it beyond words.
Thank you, Dr. Shapiro. It's
It's an
amazing.
honor. It's an honor. I invite anybody that wants actually to join us on White Coats for Change on My Vote My Health. They can go directly to myvotemyhealth.org, or in that way they can get information. And this is a moment to get involved. This is a moment to actually teach by example to our future generations and our community to actually make a difference. Um, we live in very interesting times, and we have the choice to make sure that our civic health, our mental health, and our medical health are taken care of. Thank you so much for the opportunity.
Hey, Julian, did I tell you that I've decided to make this election season my voter era? I signed up for Where's My Ballot, checked my voter status, and shared the info with 3 of my friends. I'm promoting my vote. See what I did there?
Me too. And it's so easy. Don't forget to sign up to track your ballot at where'smyballot.sos.ca.gov. And you can check your voter status at voterstatus.sos.ca.gov.
Hey, y'all, we are back for our second outro. After interviewing Dr. Ilan Shapiro from AltaMed Health Services, we are back to talk about the interview. Hey, 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 Julian.
Hey. That was so much fun.
Yes, it was. He is amazing. I could talk to him every day, all day.
He's definitely the kind of person that like radiates not only positivity but like excitement as well. Like the way he was talking about getting his communities involved and his patients involved. You're like, yeah, I want to do that too. Let me see who I can get involved. It was great.
Yeah, one of the things that I really liked how he put health equity and civic engagement together is when he talked about how, your doctor tells you that you need to exercise more. And so, but do you live in a safe place where you can do that? Where the air is clean or where your neighborhood you feel safe in running in. And I just
Yeah.
loved how he connected that, because all of those things go right back to your vote. When you don't vote, your voice cannot be heard. And so those things about your community that maybe you don't like, um, you don't have a voice in making those changes. So I just really liked how succinctly he put health and civic engagement and your community together in such a unique way.
Yeah, absolutely. And when we talk about what does civic engagement look like in relation to healthcare, those two things aren't, so obviously connected. Or if you do connect them, you think of, okay, funding for like healthcare research or accessible hospitals and things like that. But you don't think about how they're connected to your community. And like you talked about, if your doctor suggests to get more exercise and fresh air, do you have accessibility to that? Are the people who are monitoring and in charge of your immediate communities, are they taking those things into consideration for their well-being, like the well-being of the community? So those things are absolutely related, even if we didn't think about it. So I do like that he brought up that point about your vote controls your environment. It controls your accessibility to fresh foods, clean water, clean air, all of that is so closely related.
Yes, absolutely. I also loved the conversation that we were able to have about the relationships you have with your doctors culturally and how that can impact um, the trust that you have about the information that your doctor is providing. I think on a personal note, I, for the first time in my life recently, had a Black female doctor, and that was the first time I've ever had that.
Hmm.
And and I've been on this earth for some years. Uh, and just that feeling of having that cultural connection. And also, some of us are predisposed with certain health issues based upon our race. So having a doctor to sit down and talk to me not only about what's going on with my health, but also having that conversation about, am I registered to vote? This is how being registered to vote connects to your community. This is how it connects to your health. I think that is so important for underserved communities.
Agreed, agreed. And I loved what he talked about when we asked him, why is it so important to have your healthcare services, reach a specific demographic or a specific community. And just like you were saying, is having that representation in some place that's so sacred, some place that's so vulnerable, such as hospitals or a physician's office, having someone that you can relate to on a cultural level, on a linguistic level, it changes the game for so many people. So many people are scared to go seek health services because of the language barrier, because they're not familiar with their culture or ethnicity's, specific or unique health issues. So having that representation is going to mean the world to so many people. And then having them there, having them in a trusted space, and then provide that kind of information to get them civically involved for their health outside of the hospital, outside of those offices, is so important. And so having a place like AltaMed to do that is incredible. And again, not to bring up my grandmother again, 'cause I know that
Okay,
made you
here you go. You're
emotional
gonna
last
make
time.
me cry.
I'm so sorry. But like I think about her doctor visits. Obviously, as she got older, she'd had to go to the doctor more. And luckily, my family lived nearby where my mom could go with her and interpret. Luckily, my mom is in healthcare, so she was able to translate some of the uncommon words or like, the medical language and things like that. But there's barriers like that we maybe don't think about every day. And so Ultimate having this reach this whole other almost like untapped market, this whole demographic that doesn't get mainstream attention or mainstream access is incredible. And I hope we see those numbers of those demographics go up and up and up in terms of civic engagement and showing up to the polls.
Yes, 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 yes. One of the things I also thought was so interesting is the group of doctors showing
Yeah.
up at your door to make
Oh
sure
my
you're
goodness.
registered. So you got doctors canvassing in your neighborhood.
Hmm.
I just thought that that was such a unique and sweet idea,
Yes.
especially for those of us who live in larger cities. Like
Hmm.
Dr. Shapiro is based out of Los Angeles, and we are here in California's beautiful, hot capital in Sacramento, and just having your doctor show up in your community and care about not only your health, but your civic health.
Yes.
And I just thought that that was just such
Isn't
a
that so
cool
sweet?
thing. Yes, it's so sweet. It really is.
I do love the imagery that comes to mind when I think
Yeah.
about the white coats going out door to door. That's
Yes.
just like a whole extra level of just care, not even health care, but just caring. That's just caring for an individual, caring for their well-being in every aspect of their life. The
Yes.
work that's being done in AltaMed is incredible. And I know
Yes.
they're not the only ones to do this. I'm sure there are places across the state and across the nation, I'm sure, who are doing this kind of work, who need the spotlight, who need the amplification to get better resources and better support. So I'm glad that we were able to shed a light on them in this episode, and I can't wait to see what else they do in the future.
Yes, absolutely. And like we said in the intro to this podcast, we hope that you are able to take a moment and think about all of those things that connect to your health and connect to your environment and how that speaks to your vote. One of the great quotes that I just can't forget from a AltaMed conference webinar was, voting is my self-defense. And I think it's so fitting because we don't look at voting in that way,
Mhm.
but so many things are tied together with our vote. So it was a really interesting conversation, and I enjoyed it, and we hope you enjoy it.
Yeah, absolutely. Hope everyone listens, share with your friends and your family. We did make sure that, as you guys heard, Dr. Shapiro shared a little bit of inspirational words in Spanish. So we hope that can reach another, whole other audience there. As I mentioned, will be sharing this episode with my grandmother. And I hope you guys share this with some of your family and friends as well.
Absolutely. So as we wrap up, I promised Julian that I would share my amazing slogan for this week. Are you ready, Julian?
I've been on the edge of my seat since you told me about it this morning. So please, without further ado.
Thank you for listening to This is Promote the Vote California, the podcast, episode 2, Health, Equity, and Civic Engagement. We are so blessed and honored that you are listening to this second episode. And here is the slogan: just go vote, y'all. Just vote. It's like Nike, but for voting.
That was incredible. I loved it. Let's put it on t-shirts. Let's put it on bumper
Awesome.
stickers. Just vote.
Yes.
Just vote, y'all.
Just vote. Just vote. Whether you vote by mail, you vote in person, you vote early, just vote.
Just vote. Incredible. That was great. Thank you so much for ending us on that note.
No problem. See you next time, folks.
Bye. This is Promote the Vote California, the podcast, is brought to you by the California Secretary of State's office. It's hosted by Kalika Edwards and me, Julian Castillo, analysts and outreach coordinators for the Election Division. Don't forget to tune in next month for another conversation about equity and civic engagement. To learn more about our program, visit promotethevoteca.sos.ca.gov.